There's a story this week, and it's one of those that makes you sit back and go, wait a sec, how could it possibly go from bad to worse? And I'm speaking here, of course, here we are, 3 years into the pandemic, thought we'd pretty much cleared the hurdle. We figured out maybe how to deal with these things. And here's the headline. We have arrived in the post-antibiotic era. And that's, by the way, from the World Health Organization that's now beginning to warn of too few drugs, new drugs, to be able to deal with superbugs like we just did. So we thought we'd check in with Dr. Christopher LABOS, cardiologist with a degree in epidemiology, who, by the way, you can hear Sunday mornings at 8:10 here on CJAD 800. Dr. LABOS, we spent so much time talking COVID and post-COVID, and then to read a story like this that suggests, antibiotics are simply not going to do the trick, or at least that's the concern going forward. What's your reaction to hearing that?
Well, this is a problem that we've been dealing with for a while now. Antibiotic resistance has been getting worse over the years, and this is due to a number of factors. One is just the normal evolution of the situation. Bacteria are trying to survive in the same way that we are, and so the more we use antibiotics, the more they develop enzymes to defend themselves against antibiotics, and so antibiotic resistance is becoming more and more common. And we need to do two things to address that. One is we need to try to be a little bit more responsible how we use antibiotics, so don't overuse them. And we've taken some significant steps in that domain recently. So we are better about antibiotic use than we were, let's say, 20 years ago. But the other thing is that we need to develop new antibiotics, because at a certain point, whether it's 10, 20, 30, 40 years down the road, the current things that we have are not going to be as effective. We're going to need other agents if we want to treat urinary tract infections, bronchitis, staph infections, stuff like that. And if we don't develop these new antibiotics, we're going to find ourselves, facing diseases that were once easily treated that are now no longer that easy to fix, because we don't have things that can kill the bacteria as easily as we now do.
So my question, though, is you said we've been dealing with this now for a while, but yeah. I don't think I've ever heard the World Health Organization actually taking the time, making an announcement like this, which I think will raise a lot of eyebrows. So are pharmaceutical companies too slow in developing these? What's changed?
Well, one of the problems that we have right now is that developing antibiotics is not that lucrative a thing to do. And so pharmaceutical companies are much more likely to invest in things like cancer therapies or cardiovascular therapies, because that's what's going to make them more money. Antibiotic research doesn't actually tend to offer that much of a return on investment, and that is part of the problem. I mean, we've made substantial improvements over the past 10 years in terms of better cholesterol medications, better diabetes medications, because a lot of people have cholesterol and diabetes. We haven't really developed many new antibiotics in the past little while. And I think that's what's really driving the concern of the World Health Organization, which is, we need to realize that we need to change the economic structure of how we do drug development, because unless we start getting people to do research and development in the area of, antibiotics and antivirals and antifungals, resistance is going to become a bigger and bigger problem until we suddenly find ourselves with a lack of therapies to treat even, fairly basic things.
It's interesting to me that the money aspect comes into play when, according to the World Health Organization, we're losing 5 million people a year. 5 million people are dying from antibiotic resistance. You would think there would be some monetary gain, the potential there at least. But I have a sort of layman's question, Dr. LABOS, in terms of resistance. Like, I understand, if you've been taking penicillin or something, and you've developed, you personally have developed a resistance to that one. It doesn't work for you anymore, so you try a new drug, and normally if you haven't taken that drug, it would work, wouldn't it? So is it a question of the individual's reaction, or is it a question of the superbugs? Do you understand what I'm asking? It's kind of a round-the-bend question.
Yeah, no, exactly. No, here's the problem. Once bacteria develop because the way bacteria usually can develop resistance against antibiotics is basically they've developed the ability to produce an enzyme that will destroy the antibiotic before the antibiotic can destroy them, if you want to take it in a very simple level. Yeah. But once they develop that enzyme, as they reproduce, they then pass that genetic advantage on to every other bacteria. And then when bacteria get together, they can sometimes swap genetic materials. Then the new bacteria will gain the ability to resist that antibiotic. And so rates of antibiotic resistance do tend to go up the more we use antibiotics, because the more you use it, the more the bacteria have to fight against it.
Right.
And the levels of antibiotic resistance can vary based on region. There are regions of this country where there is more antibiotic resistance against a specific agent and less in other places, depending on what the local prescribing patterns are. So it's not so much the individual, it's more the environment, and more we're going to have this problem. One of the big advances that we've made is that now we use a lot less antibiotics in farming. There was a time, not that long ago, when we used to use a lot of antibiotics, because when you give animals low doses of antibiotics, they grow bigger faster. And so that practice has now changed. We still use antibiotics because animals get sick like anybody else, but you need a prescription in the same way you do for a human. You can't just go out and buy it from a feed store anymore. So just interventions like that, decreasing the overall use of antibiotics, has made a significant, it's a significant step forward in minimizing the emergence of new antibiotic-resistant bacteria.
Okay, let me go back to what I started with, which was COVID, and we're not going to talk about it, but I did want to ask, here we are many years into this. Have you seen any news with respect to long COVID? Because I know people are still dealing with that. Has anything changed? Are we seeing good news, bad news, or is this pretty much gone away?
Well, no. So long COVID is still there, and there are still people who are suffering. I think a lot of the earlier estimates about the prevalence of long COVID were probably overestimates. So it's probably less common than we would have thought. But there's no treatment for it. Yeah, really the only thing you can do is wait. And most symptoms do resolve with time, but you're talking to the order of months. And I think that's the hard part for people to accept. They say, I had COVID. I'm 6 months out and I still feel like not quite back to normal again. Yeah. And the answer is that's actually kind of common. It will resolve eventually, but it takes a while, and there's unfortunately no treatment for it.
Yeah, asking for a friend. Anything new on the if you lost your sense of smell or taste?
That's actually one of the last ones to come back.
Great.
It does tend to come back in most people eventually, but that can persist for over a year after the fact. The shortness of breath and the cough and those things tend to get better. The brain fog tends to get better. The loss of sense of smell can take. It's probably the last one to come back, unfortunately.
Lucky you, Aaron. And then I have a question in terms of us just being it seems like everybody's getting sick right, left, and center, and it might be RSV, it might be norovirus we're hearing about, or just a common cold. Are we more susceptible now because we weren't sick during the COVID years, even if you had COVID, but you weren't getting your normal bugs that were going around?
No, I don't think so, because you were still being exposed to stuff. There's bacteria and there's viruses everywhere. Yes, you were less likely to get sick, but you don't develop long-lasting immunity. If most people pre-COVID would get, 4 to 6 colds a year. So you don't have any long-lasting immunity. So the fact that you didn't get a cold 2 years ago is not going to be having much of an effect on you now. That argument keeps coming up. It's becoming... It was not that relevant at the time, and it's becoming increasingly less relevant as time goes on, because it's becoming much harder to claim that something that happened in 2021 is affecting you now in 2023 in terms of you not having gotten that cold that one time back then.
Fair enough. Dr. LABOS, thanks so much. Always great talking to you.
My pleasure. You take care.
You too.